It's Brain Injury Awareness Month. These injuries thrust into the spotlight when beloved actor Bob Saget's autopsy revealed that he possibly suffered a head injury that ultimately led to his death. He is among more than 5 million plus adults and children to suffer from these injuries in the U.S. Here with more is Dr. Victor Chang, Chief Medical Officer for Medicare and Retirement at UnitedHealthcare. Thanks so much for being with us.
Thanks for having me, Leila.
Yeah, so let's start with Bob Saget's case, shall we? Because he allegedly hit his head and then lied down and passed away at some point. Can you tell us a little bit more about what these types of traumatic brain injuries do, how they react to certain trauma, and what people need to know to avoid a situation like Bob Saget's?
Sure. Well, I think that case definitely brought to light some more issues related to brain injury. And acquired brain injury refers to any condition that did not occur from birth or from hereditary reasons. Most people think about traumatic brain injury when they hear the term acquired brain injury, but there's also non-traumatic causes such as any condition that causes lack of blood flow or oxygen delivery to the brain, such as a stroke or carbon monoxide poisoning or even near drowning.
Right. So the lesson in Bob Saget's case is if you hit your head hard enough, it's best to possibly seek medical attention.
Yeah, and it's difficult because we don't know the exact circumstances that surrounded his situation. Oftentimes, when someone is by themselves and they hit their head, there may or may not be loss of consciousness. There may be a period of time that the person has no recall of events either before or afterwards. So sometimes a person is not even aware that they sustained a brain injury, and they may just have a physical symptom or feel somewhat confused, and they may not have the wherewithal to seek attention at that point.
Mm-hmm. And when we talk about traumatic versus non-traumatic, traumatic being something where there was some type of physical trauma, either you hit your head, you were hit by something else. A lot of times in sports this takes place. So how do you differentiate actual trauma from, say, a concussion, or is it one in the same?
Yeah, so concussion and mild traumatic brain injury are often used as synonymously, and there are other severities of brain injury, so we classify them as mild, moderate, or severe, depending on the immediate presenting symptoms, and in some cases, imaging studies such as CT scans of the brain.
Mm-hmm. Okay. What is being done to further prevent those types of injuries? Because a light was shown upon a lot of young people who are playing sports and getting injured. And so there have been a little bit more mandate and rules regarding wearing helmets and things like that. Has there been any more progress in that area to ensure that young people who are still developing their brains do not suffer those types of injuries?
That's a great question. I think it's very timely, particularly this time of year when people are returning back to to sports. And it starts with just awareness and recognition in terms of adults and organized sports, recognizing that concussions are something that we can't just tough out. There has to be awareness from the players, recognizing that symptoms that can present after kind of, quote, getting your bell rung. And a lot of times people just shake it off thinking, oh, it's no big deal, just tough it out. But particularly as we look at safety awareness, we start with prevention, we start with leagues and coaches just having protocols and processes in place to detect, but also then to monitor and treat particularly young athletes who are students typically in terms of making sure they don't return back to the game too quickly, because a lot of times problems can evolve, particularly when there's concerns about these severe. I'm sorry.
Well, can you go over what typical symptoms look like in, say, a mid to more severe type of injury?
Yeah, so in more severe injuries, oftentimes there's associated loss of consciousness. Mild traumatic brain injury oftentimes does not present with loss of consciousness, but the more severe injuries tend to have loss of consciousness and oftentimes a degree of memory loss before and after an accident. There can also be a host of other factors that relate to cognitive, emotional, and physical symptoms. So one of the hallmarks would be continued confusion, inability to learn new information, inability to converse coherently with someone.
Would you also find someone feeling sick to their stomach or exhibiting vomiting or things like that? Is that typical of a symptom due to severe brain trauma?
Yes, so you can have a host of other physical symptoms: headache, vision changes, hearing issues such as ringing in the ears or dizziness, oftentimes headache or queasiness.
Yeah. And finally, with just about 20 seconds left, can you tell us what researchers are now working on, if there's been made any headway in this department?
Yeah, there's been a lot of research looking at other factors that may be present, particularly biomarkers, as we call them, neurochemicals that may be present in the brain, in the fluid surrounding the brain or in the bloodstream. There's active interest in a class of proteins called tau, T-A-U, and trying to look for very specific biomarkers that may be present in brain injury, but are not present in other conditions.
I see. Dr. Chang, thank you so much for joining us.
You bet. Thank you for having me.
Appreciate it. We're back after this.